Hello everyone, I am Dr. Ramachandran, practicing as a consultant spine and deformity surgeon in SpineDRX Center in Bangalore, and I give my inpatient services in Aster Whitefield Hospital, Bangalore. For years, spine surgery was considered as a risky endeavor. Most of the times, the people used to find whether they will be able to walk post-surgery, whether they will be able to routinely go back to their activities. These are the common questions which these people used to have before. Now we are in an era of digital world. Even the spine surgery has been digitally influenced, and not just we rely only on the eyes of the spine surgeon, but we also heavily rely on the advanced technologies. Today, I am going to take you what happens behind the operation theater. I will show you what are the advanced technologies which I routinely use in my day-to-day surgical practice. To err is human, but error in spine surgery, there will be a lot of problems to the patient. So on a routine basis, I use the advanced technologies which I'll be discussing in this video. Those technologies are making lot difference, not just to the patient, but even to me, which helps in reducing my significant amount of stress to me. The technologies like intraoperative robotic CT, navigation, ultrasonic bone scalpel, intraoperative neural monitoring, and to add up to these gadgets, the most recent advanced technology which I started using is a robot. So these technologies keep my error to the least possible, where I can assure the patient that I can give a 100% successful result, not just because of me, but because of these technologies also. To start with, I will say what it is. Spine is not just a two-dimensional picture, it's a three-dimensional anatomy. So previously, any intraoperative imaging which we commonly used was a C-arm, which gives just a two-dimensional imaging. Now, I routinely use an intraoperative robotic CT, where not just the two-dimensional imaging, I get the three-dimensional image of the particular spine model, which I make it sure that I place the screws in a precise way into the particular part of the bone. So this I used to compare with the map technology, which is the Google Map technology, which is based on the navigation system. So once an intraoperative imaging of this three-dimensional structure, which is the spine, is taken, I load it into a robotic navigation through which my instruments, the surgical instruments, which helps in putting the pedicle screws into the bone, are precisely on a live tracking being continuously monitored by the navigation device, helps in precise placement of the pedicle screws inside the bone. You can see bone within few millimeters we have the spinal cord and the nerves. Since I'm going to insert the pedicle screws very close to the nerves, I am being continuously monitored by another technology which is called as intraoperative neural monitoring, where it acts like a policeman to me, and it constantly says, and my anesthetist and my technology says, am I close to the nerve? Am I going to produce any damage? So this intraoperative neural monitoring not just helps in precise placement, but also in avoiding any drastic problems that can happen to the patient. So these three technologies, intraoperative neural monitoring, the navigation, and the robotic CT, helps me in precise placement of the instruments into the spinal bone. Okay, this is one part of the surgery. The another part of the surgery in any spine is the decompression. The structures which are pressing the nerves has to be released. For that particular technology, we use a particular device called as bone scalpel, high running midas drills, so as to achieve a complete decompression. What is this ultrasonic bone scalpel? Previously, the decompressions are routinely done by using upcuts, rongers, where instruments are inserted into the spinal canal and we take out the pressure on the nerves. But here, I specially use a no-touch technique where I don't touch the nerves at all. I use these ultrasonic bone scalpels which don't run, and when I cut the bone and remove it, the spinal cord and the nerves are never touched. This not just helps in achieving a good decompression, but also it reduces the complete blood loss that can happen to the patient. Which means the patient undergoing surgery are completely safe, and as well as the ill effects of the surgery, where the blood loss happens, is also kept to the lowermost possible, where these surgeries become more and more like a daycare procedures. Adding to these gadgets, the most important now recently thing which we have in our institute is the robot. What does the robot do? A robot never replaces a surgeon, but a robot significantly assists me specifically to put pedicle screws to an accurate precision. I use navigation, I use roboticity, but what does the robot do? My extended hands is the robot. The robotic hand comes into the picture, and through that I insert pedicle screws. A small amount of error of movements, the fine movements that can happen in my hand is also nullified, making these surgeries completely minimally invasive and safe. What is this? So the minimally invasive things using these technologies not just made the surgery safe, but also made the patient to walk within hours of the surgery. All these technologies which we have discussed in this video, to name the intraoperative robotic CT, the intraoperative navigation, bone scalpel, the ultrasonic bone scalpel, intraoperative neural monitoring, and the robot, made spine surgery really safe and made it to be like a daycare procedures. The patient can walk on the same day, return back to home on the same day or the next day, making these procedures completely safe. Gone are those days where the fear of walking is out. Going back to the routine activities, not just the official activities, social activities, playing, recreational activities are also possible post spine surgery. If you have any doubts about these advanced technologies, you can just put a comment below and you can contact me. Thank you.